Hello, my name is Rosemary Harrup. I'm a medical oncologist and clinical haematologist at the Royal Hobart Hospital and currently Director of the Cancer and Blood Services. The Royal Hobart Hospital is a tertiary hospital in Tasmania. I also am privileged to be a member of the Royal Hobart Hospital Research Foundation Board and the Cancer Council Tasmania Board. I've previously been a member of the Medical Oncology Group of Australia Executive and their chair between 2014 and 16. These roles have all helped me build a wide network of mentorships and have fed into my research career over the last 20 years. I completed my training at the University of Melbourne, and shortly after that I got married and we moved to Tasmania for my husband's job, and I worked at the Launceston General Hospital, which in those days was quite a small hospital. It was a fantastic environment. We were encouraged to think about research and to think about our futures by many dedicated clinicians there. After a couple of years as a junior clinician, I went back to the Austin and Repatriation Hospital in Melbourne and completed my physician training before I commenced training in medical oncology or cancer medicine. That journey then brought me back to Tasmania in 1997, where I again worked at the Launceston General Hospital, and then I completed my training at the Royal Hobart Hospital. By then my interests had diversified and I was very interested in clinical haematology as well as medical oncology, and I completed training in clinical haematology and laboratory haematology at the end of 2000. I was fortunate enough to be appointed to the staff of the Royal Hobart Hospital, and I've been working there ever since in the cancer services area. Throughout my time at the Royal Hobart Hospital, I've been fortunate to be mentored by a number of senior clinicians who really stimulated my interest in clinical research. I've performed research in many branches of malignant haematology and many solid tumours, but of recent years have concentrated on the area of brain cancer. During that time, I've been fortunate enough to be the local principal investigator for a number of Australia-wide brain cancer clinical trials and have been able to assist our local participants in gaining access to clinical trials. I'm always happy to advise people around the scope or the wording of their projects and to assist people in knowing about funding that they can secure for their research. In my role on the RHH Research Foundation Scientific and Advisory Research Committee, it's been my privilege to review many applications of an incredibly high standard over the years. Tasmania is a somewhat unique state. We're quite small. However, we do have the advantage of having a single health service, and this means that we can perform clinical trials and enrol patients throughout the state if they would like to participate. My area, brain cancer, is a fairly rare tumour with an incidence of between 6 and 12 per 100,000 annually. And this means that we have around 30 to 40 children and adults diagnosed with brain tumour each year in Tasmania. Unfortunately, survival rates for brain tumour, particularly in older adults, are not good. And this means that we also have around the same number of people dying from brain cancer each year. Brain cancer is quite a rare tumour. It accounts overall for around 2% of all the malignancies, and that means that we need to offer new treatments to participants as often as we can to try and improve the survival rates. And we try to have a number of brain cancer clinical trials open at any one time. to allow local participants who wish to access treatments to be able to do so. Without these local opportunities, people would need to consider travelling to the mainland, and this is not always possible with brain tumour, as often people are quite unwell. The way that we are able to participate in these clinical trials is through the collaborative group process. COGNO, of which I'm the Deputy Chair, is an Australia-wide organisation that's funded by the Commonwealth Government through Cancer Australia to perform collaborative clinical trials. This means that clinicians such as myself are able to determine the clinical questions that we need to have answers to. We then apply for resources through grants usually to operationalise these clinical trials, and we're able to participate. Without this type of funding, rural and remote sites would not be able to open clinical trials and offer participation to patients locally, and equally we would struggle to be able to offer treatments that are appropriate for the Australian environment and answering questions that are important to Australian patients. We were particularly fortunate with the Katon trial that was open here some years ago now and throughout Australia. This was an international trial that was brought to Australia, and the hope was that Australia could recruit 80 participants. And I'm really proud to be able to say that we recruited 8 patients just from Tasmania alone, so 10% of the Australian cohort. And of course, this brings a diversity to the trial that perhaps would otherwise not have been available, with the ability to recruit rural patients to what was an international multi-centre phase 3 trial. So the advice I give young doctors who are interested in developing a career in research is, first of all, choose to do your research in an area that you are interested in. Secondly, bring your passion to it. And thirdly, no question is too left field. Sometimes something that is or seems unrelated may actually unlock a whole new area for research and consideration.